This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox with you, joined on the line by the surgical director at FalseCreek Healthcare Center, cosmetic surgeon Dr. Kimit Rai. Dr. Rai, we've talked an awful lot about the variety of procedures, surgical anti-aging cosmetic procedures available at FalseCreek Healthcare Center, but there are also a number of activities and procedures around this whole anti-aging category that don't necessarily always involve surgeries, right?
That's correct.
And we talked about Botox, and there's no surgery involved there. That's just an injection of a filler agent, right?
Yeah, that's right. We have fillers that can rejuvenate the face. We basically assess the whole face and then address and see where the areas aged. We use called the beautification ratio, where we assess the upper, middle, lower thirds of the face and tell them where the areas use the word deflated. When we are born, we have our face is nice and full like a beach ball, but
yes,
when we get older, it looks deflated. So we need to replace the products that are gone, like hyaluronic acid. So that's why we have fillers today that are made of hyaluronic acid that can complement the appearance of the face and give them a youthful look.
Now, you talked about Botox probably requiring 2 to 3 occasions per year to maintain a certain look.
That's right.
What happens? Why is that? Does the Botox, does the filler that is injected eventually just go away?
They just tend to, the Botox tends to wear off, and you need to complement that, and the wrinkles that have been corrected tend to be less visible. But the issue is the muscle activity that gives you the wrinkles on the skin. So once that is softened up, it makes much better look. Regarding fillers, they tend to stay a little bit longer, but on the average, you cannot have a very youthful face with one tube only. So we need to assess and discuss the issue with the patient, how many tubes they need and how often they need to come.
So what then is the difference between Botox, the brand name, and these fillers as you describe them? Because clearly we're talking about two different things.
There are two different things. Botox is a neurotoxin that tends to weaken the muscles that are attached to the skin so that the wrinkles disappear, whereas a filler is to augment or maybe provide substance to the face to fill the area. For example, like the cheek areas might have gone down and deflated, so you need to fill that up. Or you may have the marionette lines on your chin and cheek, which are prominent, and you can fill those up. Or someone has got a smaller chin and needs to augment that, and you can fill that up with fillers to achieve the goal. A filler is just a product to basically provide fullness of the face on that area which is missing.
Okay. Now, can you explain the relationship, if any, between Botox and migraine headaches, Dr. Rai?
Well, some people use that. Usually that's called the neurotoxin. That is, the muscles in your frown lines are fairly strong, and they tend to complement. Some people get migraines with that, and they have recommended that the neurosurgeons who are injecting some Botox into the area to minimize the migraine attacks and may complement that, may help them.
Well, that's interesting. So it turns out to be a multiple-use product then, doesn't it?
That's true, yeah.
What is cool sculpting, Dr. Rai?
Cool sculpting is a process where the fat's frozen and the fat cells die and your body discharges it. It's a very nice way to remove a healthy person who has different areas of fat, particularly the love handles or women under the bra or the inner thigh or the outer thigh where they don't have a large quantity. They're very fit people. All you do is you come in and you sit down and the technician applies the device, and within the hour the fat cells are frozen, and the fat cells progressively within the course of 1 or 2 months will disappear.
Really?
So you get good shape without surgery, and you can actually be watch a movie, or you can it's not an operation, so it's a nice way to shrink the fat cells down.
Well, and another area on the body that is happens to a lot of us boomers. I'm holding my arm out, and at the bottom of my arm there's a fairly large loose flap of skin.
Yeah.
Would that be something that cool sculpting might address?
Cool sculpting may help a little bit, but if the skin is a little loose, then you may need some other treatment, called legacy treatment or so. But we have to address the issues depending on what, if they have a fullness under the bra, that would help. If they've got full, like you want a wispy look on the waistline, that would help to use cool sculpting. If you have a little pouch in your tummy, that would help with cold sculpting, so where you don't need a tummy tuck or bigger operation. Yeah.
Oh, interesting. So it's I suppose when we contemplate cosmetic surgery or plastic surgery, we need to update our mindset, don't we? Because so much progress has been made in this area of medicine in recent times that a lot of us are kind of stuck a decade or so out of sync, aren't we?
That's true. Yeah, there are new technologies available to give you better outcomes. Yes.
What's a chemical peel, Dr. Rai?
What happens is if you have fairly large pores in your skin, some brown patches, and your skin has got wrinkles, you can improve that by doing different levels of peels. Some are milder peels and some are stronger peels. We use a milder acid to try and take the surface of the skin off, and then you find that as they are healing, the pores get a little tighter, and we recommend some skincare programs to maintain that youthful look, and that definitely increases the appearance of your skin and gives you a nicer rejuvenative glow on your face.
So again, another non-surgical option, correct?
That's correct.
And how does one go about determining what the right process is? If I'm of a certain age and I'm noticing I'm a little discomfort with certain wrinkles and obvious clues to my age, and so I want to sit down with a pro like yourself. And in the course of that conversation, is that when, well, do I need surgery? Maybe some non-surgical intervention would be appropriate. How does that process get defined?
Well, the definition comes in when the consultation is done, and then the patient or the client expresses the areas of concern, and we tell them, yes, I think your face is a little aged, but you're concerned about the appearance of your skin, so we can improve that, combining that with a filler, a Botox, and a peel, and skincare. So when you do that, they're quite happy to go and come back and see you in a couple of weeks and realize how much improvement they've achieved, and they feel positive. And then they may talk about other things. I want a tummy tuck or other issues that address them. So it's always an ongoing process to get the final goal that they want to achieve.
Well, facial attractiveness is basically where this conversation began, although we didn't use that phrase. You just talked about the most popular forms of cosmetic surgery that are performed or certainly requested or talked about down at FalseCreek Healthcare Center. But what do you actually mean by the term facial attractiveness?
Well, that's because you're looking youthful, the skin is clean, it's like a clean fabric. You look presentable, the wrinkles are less, you have a we call it triangulation of your face. The upper cheeks are full, the chin is nicely prominent, and the jowls are not visible. So, and when you have, it's just like having a well-presented position where all components have been taken care of. So.
And in calculating the degree of facial attractiveness, it sounds like something that would be difficult to accomplish, but for a surgeon like yourself, it's what you do every day. But you have something called the triangle of youth that you use as a tool in all of this.
That's right. We do. We use the beautification ratios on the face and see the areas between the eyes and your cheeks where you're missing, your brow, your nose, and your chin. And as we get older, we look like an inverted triangle because the cheeks drop and the jowl and the chin gets smaller, the bone gets resolved. So when we are young, we have a triangulation where the upper cheeks are full and the chin is strong. So and as we get older, we look like the reverse triangle.
Right.
Yeah.
And so what is beautification then as a follow-up to this line of thinking?
Well, beautification is assessing the whole face and positions. The distance between your eyes constant, and then you know the height of the brow, the height up to the brow, from your root of the nose to your lower part of the nose, and the upper lip, the chin. So when you take all these proportions, you can see what's missing, and then recommend. Because if you notice, all the ratios of beautification is 0.68 to 1.168. This ratio is pretty constant. All beautiful things measure the same. For example, like the tiger's face, the butterfly.
Okay, sure.
And beautiful women have the same ratios as well. So.
Interesting stuff. I can't let you go, Dr. Rai, without again referring our listeners to the website for this charitable enterprise that you've been a part of for almost 20 years. You take surgeons and nursing teams from Canada and go into disadvantaged countries all over the planet and help little children with facial deformities. It's called Operation Rainbow, and the website again, sir, is?
OperationRainbowCanada.com.
Excellent work. Congratulations on that, and thank you so much for your time today. It's been a real pleasure having you on BoomerLife.
Thank you very much, too.
Dr. Kimit Rai, Surgical Director at FalseCreek Healthcare Center. Online at FalseCreekHealthcare.com. See you next time, right here on BoomerLife.